when you're very well organized, you are systemized in your workload, and you never feel stressed out or anything.
Well, I think I'll stop you there.
I have loads of female physiotherapists. They all come with the aspiration to become an amazing clinician first. They become just a basic physiotherapist. Who's the best coach? Is it a female coaches are the best for the female football, or a male coaches will be the best? Carys, thank you very much for joining me on this podcast. It's lovely to have you here at Excel Health in Kent. So what I want to talk to you all about, being a physiotherapist, you are in the world of elite physiotherapy world. At the same time, you are an entrepreneur in your own rights. And we both share so many values in the same level.
Yep.
But as I said, I see you two steps ahead of me. When you're very well organized, you are systemized in your workload, and you never feel stressed out or anything at all. And I want to gather some more of this information so that we can inspire a couple of people today on this podcast so that they can follow your footsteps, so they can achieve something better for themselves.
Well, I think I'll stop you there, and I'm gonna bring in a swan analogy from the start of this, Xavier. So you may think that I'm not stressed out and that everything's under control, but I am literally like a swan. My legs are going like billy-o underneath the water. So, I look at what you guys are achieving with Excel Health, and it's absolutely phenomenal. And I'm thinking they're 3 steps ahead of me. And I think as a profession, we're very analytical of ourselves in a lot of ways by comparing ourselves to other physios, but we're not always that self-reflective in ourselves and seeing how well we're doing or where we need to ask for help sometimes. So it's fantastic that you see me in that way, but I don't think I see myself in that way half the time.
But I think self-reflection is the best tool we should have all the time. And when I was working in NHS after 15 years there, and I was writing my CV after a long time, updating my CV, and I was writing there, I was working with that spinal surgeon, I was working with this shoulder surgeon, I was listing people in King's College Hospital directly for spinal surgery, Canterbury Hospital for knee replacement, Medway Hospital for hip replacement, direct listing. I thought, wow, that was a great journey I have had. Not many physios get to do that level of, job satisfaction wise. I thought, wow. But I do. Now I'm working with around 40 physios in our business. Yeah. And I don't see that everybody is self-reflecting enough.
No.
And particularly the point I want to talk to you about, I have loads of female physiotherapists. They all come with the aspiration to become an amazing clinician first. Second, they want to be successful in their career.
Yeah.
Some of them want to become an entrepreneur in their career. But all of a sudden, that motivation tips down and they become just a mediocre life. They become just a basic physiotherapist. I couldn't work out, what changes in their life that they go down the hill.
No, and I think I've been in a very privileged position within my career that I have, a lot of my elite sport background was in female football. And I started before it looks like it does today. And I'm very honoured to be part of the history of the development.
Yes.
So I've had the opportunity to work with some fantastic female coaches, female physios, obviously female players of all ages, and see their development, which has been amazing over the last few years. But again, I think there are some commonalities, whether it's that they have maternity leave,
yes,
and that priorities change. But then you could argue that there's a lot of male physios that also have kids and have the same priorities, whether that's different. I haven't got kids, so I can't say that would, I can't kind of comment.
Mine was changed definitely for my profession, and the business life took a back seat when we had a very young children, and because their school run, their school holidays, everything prioritized differently. Yeah. But my wife was so supportive to me, and she gave me a very strong platform
Yep.
where she looked after the children amazingly well, and she planned everything for me
Mm-hmm.
while I could focus on my business and grow as a
Yeah.
entrepreneur and a good clinician.
And I think, I've seen this. Some of the best coaches I've worked with in the female game have been female. Some of the worst coaches have also been female. Obviously, I will not name names.
No.
And actually what I saw in the FA at one point was almost like active discrimination against some of the male coaches who were
Wow.
absolutely brilliant, but because they weren't female, and rightly the FA were trying to give more women opportunities within the female game, they didn't get some of the opportunities that the female staff did. Obviously, you try new initiative. It wasn't done in any purposeful way, but you try new initiatives and you don't always know if they're going to work out or not. Sometimes you do have to take that risk. And, there was a lot to try and get more females into the higher levels of coaching, management, medical staff, the whole shebang. But sometimes that didn't always give the opportunity to the best person for the job. But I don't think there's an answer for that. And coming back to your point about whether female entrepreneurs develop to their potential or not, I don't know whether it is priorities change, or we all know you've got to take opportunities as they come. And if something stops you from taking that opportunity, which maternity leave potentially could,
Yes.
getting back into that network, that world, etc., might become more difficult. So I don't know whether it's a personality difference, and men and women are quite different in lots of ways. Like you've said, I like to be organised. I think I can bring that to the table, and I work with people that are highly creative, but maybe aren't as organised. And we recognise and we self-reflect to identify where my strengths are, where their strengths are, where their weaknesses are, and you work as a team.
Yes, of course.
Whether that's within your own business or strategic partnerships. And over the years, I've become more interested in strategic partnerships with other people and other businesses than creating everything and internalising everything within my own businesses.
Wow. This strategic partnership is the best thing forward. Otherwise, remember this way, without John Hobbs, credits to him, and thank you, John, we wouldn't have met.
No, absolutely.
And we both, our organizations are now very, very closer now in supporting the newer university graduates and students and everything. The strategic partnership is really important. Many people really undervalue or estimated less of this strategic partnership, mentored, and also self-reflection. And this is the best way you have come along. In FA, female FA, world, who motivates the player often? Is it who's the best coach? Is it a female coaches are the best for the female football, or a male coaches will be the best?
I think it's very similar to physio. We are different clinicians. I've got several versions of Carys the physio, all along the same kind of theme, for different patients. And it's the same with players. You've got to know your players and you've got to be able to people manage. So you can't just be a great coach of putting some cones out, telling them where to run and whether it's a 4-4-2 or something different. You've got to be able to identify the psychology of that player. And I've been very fortunate to work along some excellent sports psychologists in my time in sport. And they transformed the way I approached coaches and players and dealt, especially within the female game and teenage girls, because they are a law unto themselves sometimes. So I think the best coaches, it isn't a male-female thing. It is a coach that can recognise when they might actually be better referring that player to somebody else for their management because their personality types more align. Or they are able to adapt what they're doing with that player at different times, either through the month with some female players or through the periodisation of preparing for an event or what have you. And it's the same in physio. We are different. When somebody's in acute pain, we might need to be more nurturing, more reassuring.
Reassuring,
to take them out of that pain cycle. And then when they come in 6 weeks' time and they've not listened to a word you've said and followed the advice, then you get a bit tougher with them because that's what they need. But they're not maybe in that acute phase, or it's a bit longer since the accident that caused that. They're ready to listen to you more.
Yes.
So I think it is around people management, and the best coaches, physios, sports docs, sports psychologists, education and welfare officers, physical performance coaches, sports scientists, whoever it was that we were working with, and we worked as a great multidisciplinary team. The best ones have been the ones that listen to other staff.
Yes.
To get intel around who they're working with and adapt what they're doing to progress that player, patient, whoever it is.
So the point I want to next talk about, succeeding as a female entrepreneur or a female player or a female football physiotherapist.
Yep.
What is the most important thing a person should have, either a female or a male? Is it the mindset to drive further, or motivation to achieve something best for them?
Yeah.
So they can be the role model?
Yeah, I think when I got into football, and it was by luck, some of it is by luck. However, a lot of it is making sure that you recognise an opportunity and you take that opportunity. So I started out at Stoke City Football Club at a time where there weren't many paid roles in football.
Okay.
So I'd been offered a big Band 5 rotational post at one of the top hospitals in Birmingham. And I turned it down because I got a part-time NHS job, temporary contract, 6 months.
Yes.
But I'd been offered the job in football a day before I'd been offered the Band 5 rotational. So I was in the middle of a field at a music festival, making the most of my last summer before I graduated, when I got the phone call. And I couldn't believe, as I was talking to this superintendent physio, that I was turning down a gold dust job because it was 2009 I graduated. There was a massive shortage. It was one of the really tough years. So I think half of my year never went into physio because there weren't enough jobs.
Okay.
There'd been too many trained and not enough jobs. So I knew I'd really achieved something by being offered this job.
Yes.
But if I was going to work in football, I had an opportunity.
Perfect. How did you get into this, your favorite football clubs and your journey with the professional football?
So from Stoke, I started with the Girls Academy and the women's teams. And within a few months of working there was some jobs coming up at the academy. And the academy medical guy at the time was kind of chatting to people in the club. And the technical director that was my boss, an ex-professional footballer, was my boss that was running the Girls Academy, said, I think you need to speak to our physio. I've been really impressed by her, and just kind of... And I got approached by them to go and work for the Boys Academy. So worked with them. So just kind of took every opportunity that was offered.
On your way.
Yeah.
Yeah.
But those opportunities only come up if you have the right mindset of, I'm going to put everything into this job. I'm going to put everything in. And when I graduated, I will admit I was flying by the seat of my pants my first football season.
Wow.
My degree hadn't prepared me for it. I hadn't had a sports placement. I'd done sports all my life. I come from a hockey background.
Yes.
So my sympathy for football injuries is very minimal, because if it's not a stick or a ball injury, it's nothing in comparison to what I'd seen on a hockey pitch. But yeah, I took that opportunity. I put everything in, but I was underprepared. So I realised that I put myself through extra courses. I did loads of reading. Each week I'd come home and make sure I revised my anatomy. I looked at the injuries. And also I was working with a mixed demographic, peds.
Wow, really?
Sports injuries. So it was through from under 10s up to adults that I was working with. And I had to educate myself on the difference, because there's a massive difference. Angela Jackson, she does loads of work on paediatric sporting injuries at the moment. If you haven't checked out her work,
I haven't.
Fantastic.
But I thought this is the area not many physios are trained in UK.
No.
pediatrics and sports injuries.
Yeah.
We do get to see them in private practice, but there is no specialized physios.
No.
Wow, okay.
So I made sure I identified that was an issue. I made sure I went and did courses that helped me with that. My own reading, because you don't have to go on a course all of the time.
Yes.
They're very great, but you need to make sure you're doing your own development.
Self-taught, yes.
So that first season, I didn't stop reading. I'd get in from training at 9 o'clock at night and be making sure that I did, a bit of reading to make sure that I'd done the right thing by these kids. It's important to get it right when they're growing and they're developing. So after that first season, I then put in a placement with me at the football club. But in that time, what had happened was they were happy with my work. They were really happy with what I'd done. And one of the women, Kath Tranter, fantastic lady, did so much for the game. She was a player herself, got injured, had to retire, and just the hours that woman has put into the female game in Staffordshire and beyond is phenomenal. And she was in charge. She worked for Staff's FA, and the trials for the England squad were being held locally. That's where the luck comes in. The opportunity comes in that she said, are you available on this date? I need a physio to cover some England trials that are being held here. And I wasn't, but I made myself available.
Yes.
I just thought this is a great opportunity. And this was before the Lioness pathway as it looks now existed.
Wow.
There were no professional options for women.
So much of groundwork was done those days to be in this state.
So I got asked to do something. I said yes, did it. And then when the pathway developed, they took me with them, basically. So
one thing resonates with me when during my first day at university, the dean of the university gave us a lecture, and he said, always dream bigger.
Yeah.
Your opportunities will be always up in the sky. Never look straight and think that the opportunity will be right ahead of you. Never happens in the world.
No.
Millions of opportunities are presented every day to us. And as a female entrepreneur, and you took every opportunities available, one led to another, you are where you are at the moment. The same thing I did. In every opportunities, I made myself available. I met the right person in the right time, or I was in the right place at the right time, took the opportunities, learned behind it, and worked the way up. And do you see that in the Gen Zs or the new generation think that the opportunities has to be presented to them? They don't need to look out for? Do you see that in sports or in your own private practice?
I've seen it in both over the years. I think it's like with everything, you get good and bad in a year group. But there does seem to be more of an expectation that opportunities will be given without having to earn them.
Yes.
Show your worth. And that brings me really nicely onto where I then went with the placements at
Wow,
Stoke.
go on.
So after my first season, I realised I was covering 4 football pitches on a Saturday with 4 different games going on because there wasn't the funding within the budget to cover 2 or 3 physios. Okay. So, and I'd had that year going, I wasn't prepared for this by my university training. What is the solution? Lack of budget and a need for better training.
Yes.
So I went to the guy that was running the Girls Academy, Richard Carter at the time, and I said, Richard, can I start a student placement? Can we do a season-long internship next year? Because I think it would be great to get the students the experience. I could provide a better service for the players because I'd have some extra bodies, basically.
2 pair of extra hands.
And he went, Carys, I trust you. You can do whatever you want, but there is no more money. So here is the physio budget. You roll with it and you present back to me next week with what your plan is. So I went away going, well, it's not a no, so that's fine. So cut a long story short, did the budgeting, figured it out with all the processes and procedures at the club, because obviously there were safeguarding procedures we had to follow, DBS checks.
Yes.
figured out how we were going to get the students pitch side qualified as well. And I was very lucky that I then had contacts within the FA medical education set up. And we ran for several years with a year-long internship at the football club, where I would take ideally about 10 students a year, and we'd have them on a rota. They'd cover a training session and a match day.
You had your student placement planning right from when you were very young.
I did.
So it's within your blood.
1 year after graduation. And it made me keep on my toes and help with my development. But I remember, and this goes back to the mindset and the questions, sitting at home, doing this budget, planning all the training I was going to do with the students, and my mum sitting and going, they're not paying you enough to do this. What you get is, you tell me, is this worth it? Now, I come from a background where my mum was a ex-business banking manager before she was made redundant. I didn't have pocket money. I had a cash book where I had to go and justify withdrawing my pocket money, and it would be I would be rewarded for cleaning the dishes. I think 50p it was in the 90s, you know.
I still pay 50 pence to my children.
There you go. So, yeah, inflation, ignore it. It's fine. So I'd have to go and sit in front of my mum and justify why I wanted £3 for Ms. magazine or whatever it was.
Yes.
Okay. And she still did that to me as an adult. Is this worth your time and expertise? They're not really paying you. What you are giving to that club is far beyond what you should be getting paid and all the rest of it. And I said, I think it's worth it, Mum, and I want to do it. And again, a lot of work has been put in to get to the stage I'm at, which people don't see. They don't see the late nights standing on the pitch in the rain. They don't see the cold
weathers, yes.
They don't see me turning up to a match day with my hockey kit underneath my football kit, so I could run off the football pitch from work and go and run on the hockey pitch.
After that.
Try and play after that and keep that side of my life
Amazing.
going.
That's where the entrepreneur just born.
Yeah.
And with that support from Richard and everybody, made you as a great entrepreneur.
And I was lucky that I had the right people in place to support me, even though they were non-clinical. I felt supported, which was great, but also they pushed me. And that's what I felt you need.
Carys, have you read the book called Unfair Advantage?
I haven't.
Please read the book. Your story is there.
Okay.
And my story was there as well.
Yeah.
We think it's lucky, but we made the luck there. You engineered the luck by speaking to everybody, running from one pitch to the other one. And that luck happened just because you made it possible.
Yeah.
That book is amazing, and how these two guys are amazing entrepreneur in UK. This is the guy I worked with, Just Eat, on the early stages.
Yeah.
What's his name? Hassan and Ali.
Yeah.
Lovely people, and amazing book. You should read it. Unfair Advantages. And the world is very unfair in every front.
Yeah.
But what we consider as luck, what are the unfair advantages we all have as an entrepreneur? And we present it to the world so that we get rewarded in whatever the way. As your mom said, you're not getting paid for this. You could have stopped it.
Yeah.
But you were doing everything which made you as a better person who you are today. And another one I want to ask you, do you see a correlation between entrepreneur mainly made because of their sports mindset or their experience of in the pitch or on the pitch or off the pitch? Because I haven't seen many entrepreneurs who are just out of books or just out of university. These are the people took everything through as being a streetwise person, learned it as they go along, made it as they go along. What is your thoughts on that?
And I do. I mean, I've been thinking about this since we've been chatting, and I don't know whether it is a difference in the personality, the typical personality types between male and female. Female, and I am stereotyping here, but could be seen as a little bit more easily offended, or, and I've certainly had it within my career where people have, described me as arrogant, whereas my male counterparts have been described as confident.
Yes. I've heard that. I've seen that.
Yeah, I've worked with people where I'm the senior, but there's a male next to me and they assume that he's in charge. I felt that a lot of my career I've had to be twice as good as some of my male counterparts to get the same level of respect. Some of the things that have been said to me in football changing rooms and on the side of the pitch, I definitely won't repeat on a podcast, but, and my male counterparts haven't had to deal with that.
Yes.
So I don't know whether it's a natural selection that causes what you're describing, that actually I'm quite stubborn. I come from a sports background where there has been plenty of things not said always in the nicest way, but quickly and efficiently, and there's been banter afterwards that means you've got that in you to deal with. My mum's from Liverpool as well, so there's a bit of scouse in me that, gives me a bit of kind of that bite back, I think.
Which team do you support, football?
So that's a great question.
Liverpool or Manchester?
No. So with a name like Carys Roberts, many people will realise I've got a little bit of Welsh in me as well.
Honestly?
So my dad is from Wrexham, Xavier.
Wrexham.
And I have I think it's a 1994 Wrexham shirt that my mum went mad at my dad for buying, spending £30 in 1994 on my shirt when I was, 7.
Uh-huh.
I still go to matches in it to this day. It still fits because it's a large boys. So it used to be like a full length dress on me. So I feel like I have to give that bit of information to justify me supporting Wrexham these days because we've got Hollywood owners now. So I'm not on a bandwagon. So Wrexham.
No.
Yeah.
But their journey was beautiful and
it's fantastic. And when you say about opportunity,
yes,
the fans bought the club.
Yes.
The love of that town gave them the opportunity to have the Hollywood owners.
Yes. And they are now far ahead in their league and they just keep going up and up. Mm-hmm. And maybe in a few years they will be in the Premier League.
Yeah. And do you know what? The head physio at Wrexham was one of my first students in that first placement at Stoke City Football Club.
Wow.
And he was great, Kev Mulholland, and he gave his time. He then got a job within the boys' academy at the football club, and went from there because he took the opportunity of that placement offering. And they weren't paid. It wasn't accredited hours. It was hard work.
Oh God.
And my senior physio in my clinic is also where I met her. Was that first placement in 2010.
So you have a real good relationship with the placement and the model is really working for you.
Yeah, it is.
And you're flying with it. What are the stumbling blocks or the difficulties, as you said, few of them, which limited you in the journey of a female entrepreneur?
I mean, I've grown up in Stoke. I was given a lot of opportunities by my parents, but I wasn't private schooled. A lot of people assumed I was because I played hockey. My mum and dad were employed. They didn't have their own businesses. I didn't have a business network. So I think when I started in business, it started from my passion for physio, which anybody that knows me, I have a massive passion for physiotherapy and the development of physio and healthcare and
the profession itself.
Yeah, absolutely. But I also worked at uni through my summers for a local business, and I knew that and they told me to drop out of the physio course and work
focus
for
on
them
some business
and be a businesswoman. Basically, I went, no, I want to be a physio. But I think one of the stumbling blocks was I started in business and I didn't have a business network.
Okay.
So I knew that, and I went out and got a business network that was more business to business rather than business to consumer, which is obviously the traditional model of clinics. Yes. And that wasn't to get massive occupational health contracts or anything like that. It was more to educate myself from fellow business owners about how the pitfalls that they're falling into, the successes, and then decide what kind of business owner I wanted to be from that.
Wow.
So I did a business networking. I joined a business networking group. I invested in that and my time in that to speak to people. And not everybody I spoke to was somebody that I I want to model myself on you. Mm-hmm. But it all gave me information about, I'll take that bit from them, that fits with my philosophy, that would work for my business model, etc. So I think one of the stumbling blocks was I didn't have that network, but there's ways to go out and get that network.
Yes. You went with not a traditional route, but completely different route.
Yeah. And within that, I think I was young. I was in my 20s. I started business quite young. I was 25 when I set up Swan Physio.
Wow.
And it wasn't a plan. It was more a necessity of I needed to do something different than I was doing at the time. And it all happened very quickly. And I was very, very lucky through my contacts at the FA. St George's Park had just opened, and I was able to get some part-time pitch side work. And that helped me to pay my mortgage while I started the business. So again, great opportunity, and I took it and I ran with it. But I still think people underestimated me when I walked into a room. And I don't think they underestimated male counterparts in quite the same way, who were the same age, same kind of stage. But that's fine. I love it when people underestimate me.
You have a great unfair advantage there, honestly, and you will be great. And if you happen to speak to a group of young female entrepreneurs who have the aspiration to become an entrepreneur in the world of physiotherapy, healthcare profession, something as a business, what would you advise to them?
My advice would always be confident in who you are, know who you are first, because people will question it, and that goes for everybody, but people will question it more. I also think, from what I've seen, physio is a predominantly female profession, although I think that is changing with various things. And I don't always feel like women support women as well as they could do. I feel like we can be a bit catty, we can be a little bit competitive. And actually, if we support each other, fantastic things happen. Absolutely fantastic things happen. So if I was providing that advice to females that want to go up, make sure you look after each other, support each other. And there is a bit more out there for now, for that.
A lot more.
Which is great, but there wasn't when I was coming through. So that's brilliant. But know who you are and support each other, definitely.
My daughter is now 14 years next week.
Good luck.
And so 2 years ago, I was asking the question, Abby, what do you want to become when you grown up? She said, Dad, I want to be a businesswoman. I said, well done. And be confident in yourself and grow up nicely. Understand world is not the same what you see outside. Completely different. There's a huge mechanism runs behind it. You need to learn how to fix that mechanism so that everything looks perfect outside, like a clock. And I was explaining to her, and till date she hasn't changed her mind. And I'm encouraging her to pick up a profession, whatever it is she want to become in a profession, but be confident, learn everything within the profession.
Yeah.
And you need to use age as an advantage so that she can get into that profession very early on, just like you did. Yeah. So that I got into the business world when I was 28 or 29. So because of visa restrictions and everything, if I happened to be in business when I was 23 or 24, I would have been completely in a different level, hypothetically, I could think of.
Yeah.
But that's great. So another thing I want to talk about, as most entrepreneurs, we are all crazy. 110 things in our brain.
Yeah. Those legs going underneath the water. Yeah.
We'll be working on 10 different things at one go. What keeps you motivated in all this journey? And you have a great vision ahead. What keeps you going?
So it's not always all unicorns and rainbows, as I'll say. Okay, it is a lot of swan legs going underneath that water. This week in clinic is what keeps me going, my clinical caseload, because I am still a clinical physiotherapist alongside everything else I'm doing.
You do.
And this week I was chatting to my patients. Know I've been coming here, and that I'm doing other bits, and they're really supportive. As long as they say, as long as I can still get to see you, And one of my long-standing patients, who I've been on quite a journey with, just went, Carys, I think what you're doing is wonderful. It's what is needed, and I'm so appreciative. I always like chatting to the students. Your level, I can see you're maintaining your level, and that feedback is what keeps me going from the patients and the great outcomes we get. And there have been several cases from my own clinic of patients that wouldn't have got the level of treatment that they got if I hadn't had some students there to assist with that and spend that bit more time with them than either they could afford, because I've subsidised some treatments to help them, or that I could spare or sometimes had the energy for, because I do think we're not always the most compassionate to ourselves.
That's true.
With how we're feeling when we're treating. But also some of the students, seeing them succeed and seeing what they are doing for patients keeps me motivated. So everything comes back to Carys the physio, clinical, and the outputs we get with patients.
This is exactly the same situation. Lots of my patients are so proud of where I'm going.
Yeah.
And they're so proud. Everybody will come and say, Xavier, I hear that you're opening another clinic in Bexley. How did you know that, Richard? I'm watching you everywhere.
Yeah.
The social media really presents them very well. They're all so proud. I'm so proud of you. These other people saw me when I was in a very small room in Sittingbourne in a host house, and just working on my own.
Yep.
And they see me now, this many people, and they ask me, how many more physio you hired this week?
Yeah.
How many new managers you have hired this week? And they are great advocate for me to go further and further. They're extremely proud, and I'm extremely proud to be looking after them. Great feeling that is. In a physio profession, we all want our profession. We all think we need to develop better. But in your case, I could clearly see that you're working for the betterment of our profession.
Yeah.
Physiotherapy profession. I could see that our profession need to be going further and further up and get more attention, and we should do far better to our profession. Where do you want to see our profession in 5 years' time from now?
Well, I had a great chat about AI with somebody this week. I think there are obviously mixed views. It's a developing world, but I think innovation within healthcare, I think our profession is in a massively advantageous position to develop innovation for the betterment of the treatment. I think in 5 years, I'd like to see students understanding their options, their career options, that there isn't just the traditional route available. And I think that is happening. I think it might be easier to say what I don't want to see.
Okay, go on.
I don't want to see a lack of compassion towards patients or lack of manual hands-on therapies. And that is my concern with where the profession's going, and the concern of a lot of physiotherapists that I speak to, particularly in private practice, where we are still, using a lot of manual therapy techniques and a lot of different techniques than are being used elsewhere. And this isn't to spark an NHS versus private debate. There are kind of places for both within the healthcare system. But I want physios to make their own choices based on knowing about all of the options and being autonomous clinicians, rather than making decisions not knowing what they don't know. And that's my fear for the profession, that I'm not sure the graduates and the kind of ones that have previously graduated over the last few years realise there are other options out there in the treatments they could do that could get success. And that's not good for patients.
That's true. Absolutely agree with you. I felt that same many years ago. Our experiences are quite overlapping. My experience once while working in the NHS, one physio manager clearly saying hands-on therapy doesn't work. We're all going with the counseling and acupuncture. And straight away I went and spoke to one of my mentor I had, and I said, Arthur, is this the case? Do you think hands-on therapy doesn't work for people? You've been a physio for 20, 30 years. He said, Xavier, you're doing an amazing job. Just crack on with what you're doing. Do not worry about this advice. You need to move hands off at all. Everything has its own place. We are physiotherapist, physical therapist.
Yeah.
We need to be hands-on because that's what many people want to help with their problems.
Absolutely.
But everything, exercise, counseling, education, everything has their own place.
Combined approach.
Holistic. You
Yeah.
don't need to say that, hands-on approach is not good than other things. Last thing I want to talk about, people have heard you as a highly specialized physiotherapist and amazing entrepreneur. Let them also see a softer side in Carys.
Many people will say that doesn't exist, Xavier.
I know there is one. So it's a quick fire round where I'll ask you 5-6 questions. You tell me whatever comes to your head first.
Okay, go for it.
What's your favorite game? One
Well,
word.
it was hockey.
Okay. Now?
What games am I playing now? I don't know.
So we'll take hockey as
Let's go for hockey.
I thought
I went very
football will be your
sports there.
favorite game.
Oh, I've seen a lot of football over the years. I think I got saturated with it. Rugby league is my new game.
Wow, okay.
Yeah, not to play, to watch.
Okay.
Yeah.
Next one.
Mhm.
Which is your favorite place to be in?
I love the countryside. I'm very fortunate. I am surrounded by countryside where my clinic is and where I live, and I love just being outdoors in the countryside. Usually walking to a pub is very nice as well. So
At the end of the walk.
at the
maybe.
end of the walk, yeah.
You're not given 2 minutes to think about. If I give you an option to book a flight ticket to a destination of your holiday choice, which one will be?
I loved New Zealand when I went, and that's where I would like to go back to at some point.
I saw some Australian.
It was Australia. I have three great friends that live in Australia, so I'm out there next year. So I'll get your imaginary flight and go to New Zealand.
I thought you will say Australia, honestly, because the sporting mindset and the direct approach, I thought Australians, a lot of them will have. What's your favorite food?
Food, pizza. I love Italian.
Well done there. And what's your favorite book, entrepreneurial or self-development book?
One of the best books that I've read, and I'm trying to read more to help with my mindset.
Please
and
do,
switching
please
off
do.
And myself. Kevin Sinfield's book I read last year. That is one of the most inspiring books I think anybody can read, from what he's done for the motor neurone kind of community.
Development, okay.
Yeah, but also just how to be a better person, the friendship that him and Rob Burrow have had, but also the challenges he had within his sporting career. So I think there's bits from there that everybody could take from it, no matter what they were doing.
Wow, that's amazing. What? Who's your favorite author?
Roald Dahl. I grew up on Roald Dahl books. I love them. That fits in with crazy as well, doesn't it?
I've read them to my children.
Yeah. I think they maybe haven't aged very well.
No,
though.
they haven't.
No.
They are still in preschools and children's styles.
Yeah.
Everything is still there.
Oh, that's okay then. That's good.
So that's the inner child still well nourished in you.
Fantastic.
Thank you very much for your time. It's amazing to catch up with you, and I love the energy you have. Please keep that going for many more years to come,
I'll try.
so that you uplift our profession to a next level. Amazing job you're doing. Please keep it up.
Thank you. It's been an honor.
That is the reason we say that keep it moving all the time.
Yeah.
I tell my patient, keep it moving, keep it going, and you need to do the same.
Thank you.
Amazing job. Well done. Thank you.